Yeah. Okay.
And so we want to welcome again Mr. Mejia, who is coming over from the Sonoma County Department of Health and Human Services, or right. And one of the things that we've been doing for a long time now, over a year, I think, is every week we try to bring people up to date on what's going on. I'm interested in when are we going to likely make it to the next level. So we went from purple to red to orange. What is it looking like before we make it to the next level?
It's looking like we have great opportunities to move to the next tier, which is the last one in the route to opening the economy. That's the yellow tier. Mm-hmm. Because our indicators are marking that we have 2.5 new cases per every 100,000 cases. The COVID cases keep dropping. And if we continue this way, as soon as we hit 2 or below for every 100,000 cases, then for a sustained 2 weeks registering those numbers, that moves us to the yellow tier. What that means is that the economy reopens widely, more than what it is now. It also means that larger gatherings will be allowed, both outdoors and indoors in many cases, like restaurants or movie theaters or bars or gymnasiums will be looking pretty much like the way they were before COVID hit. Mm-hmm. You know, mitigation measures are going to be still in place, still recommended. It's going to become something more like a moral issue, you know, to protect oneself. By protecting oneself, we can protect other persons. But we cannot specify a date precisely and specifically, because it's a common effort. It depends of all of us to continue using the mask, to keep washing our hands, to avoid crowds, to avoid poorly ventilated places, and to keep testing and continue vaccinating. The vaccine is, everyone is eligible now above 16, including, there is word that the Pfizer vaccine is going to start being used for kids between 12 and 15, probably in the next month. You know, so the vaccine eligibility keeps widening, the vaccination amount keeps increasing. You know, we saw above 18,000 doses were available for the county this week, compared with the previous weeks when we were in 11,000, 12,000, 13,000. We jumped to more than 18,000 doses available now. And this is weekly. So, you know, the opportunities are there. The invitation for people is to go ahead and get vaccinated. There are many opportunities to do it. You know, calling your doctor is the first one. Making an appointment on myturn.ca.gov. It's another opportunity to do it online. You can obtain vaccines also in your pharmacy, in your favorite local pharmacy. You can make an appointment with them. You can visit the county's website, socoemergency.org, or you can call 707-565-4701 if for whatever reason you don't have access to a computer. And there are also specialized clinics in Roseland, at the Roseland Library. That's located in 779 Sebastopol Road, and that's open Tuesdays to Fridays from 9 to 6 and Saturdays 10 a.m. to 3 p.m. And walk-ins are welcome. And the same occurs in Sonoma through La Luz Center, located in 17560 Gregor Street in Sonoma. And that's open on Tuesdays and Thursdays, 2 days during the weekdays, from 12 p.m. to 7 p.m. And it also opens on Sundays from 12 to 3. And that's walk-ins are welcome over there too. And they have a telephone number where you can call in case that you have any question, and that's 707-939-6070.
And again, it's important for people to know that there is no longer an excuse. You start with your primary care physician, and then again, for those who don't have one, you have the health clinics. What was it, Tuesday, we had over at the Huerta Gym, Alliance Medical Center open up just without appointment between 5:30 p.m. and 7:30 p.m., something that you said, right? A lot of people work until 5. Well, there you are. There's an opportunity to show up all the way until 7:30 p.m. And then yesterday they did it in Hillsburg at Hillsburg High School. So again, it's just about picking up that phone, making a phone call if needed, and finding out what's the closest place, when's the next event that works for me. And so people just need to take that responsibility and take advantage. As I was mentioning in Spanish earlier, the United States bought literally hundreds of millions of doses of vaccine from all these companies, from Pfizer to Zeneca to Johnson & Johnson, Moderna, and several others. And now that these ones have been established, the United States still now is going to have piles and piles of vaccines, yet people in India, people in Mexico, people in other countries don't have access to the vaccine. And the wealthy people in the United States already vaccinated. People in the middle class are vaccinating because they have access to health insurance. And interestingly, is the poor members of the community, the ones who are being told that maybe there's something wrong with the vaccine, that maybe there's a chip in it, whatever the situation is. And yet we keep falling for those lies, and we refuse to get vaccinated. The wealthy and the uber wealthy of this country are not going to take a risk because they want to keep all their billions and billions of dollars. So they got vaccinated as quickly as they could, right? And so we need to take it. We need to take all these opportunities, and we need to get it done. And it's as simple as that. So it's important, as you mentioned, there are phone numbers people can call. They can go to socoemergency.org. And as a result of that, there is a whole listing of locations where people can get this. And the other thing that you mention every time you're here, again, the need to get tested, to wear your mask, to keep your distance. And there was this new direction from the CDC about people who have been vaccinated. Could you tell us what that new direction is?
Well, there's opportunity for people who's fully vaccinated. It's lessen restrictions for traveling or for gathering. You can gather with people who's also vaccinated. You can gather without using mask in interiors too, right? If both parties are fully vaccinated, you can gather even in interiors where people who's not yet vaccinated, as long as they don't have a high risk health. You know, as we know, diabetes, high blood pressure, asthma, lung problems, or vital organ problems. There's people with affections in the kidneys, for example. All those are considered high risk, including overweight people. We have seen through the year that people with any of these conditions, there's a tendency for them to suffer more severity during the symptoms of COVID. We have seen that. So again, it's a moral responsibility. You can get together, but you have to be responsible, right? If you're going to get together with your relatives and you have elders who have any health threatening condition, well, you might as well prefer to wear your mask, even if you're fully vaccinated, because as we were mentioning earlier, Rafael, as we circulate more with more people, not knowing if they are vaccinated, and at some point we won't know. You know, you will see just people without a mask, and most likely we're not going to be demanding COVID passports. You know, we will just believe in the faith of people.
Yeah.
So I think at that point it becomes a moral issue that you know, you want to treat yourself, others the way that you want to be treated. Exactly. So if you treat others kindly and with respect, that means that you are treating yourself the same way. You know, so respect yourself by respecting others, I think. And COVID is giving us that demonstration. The COVID doesn't make any differences, really. It takes equally.
Definitely, whether you're
the poor
rich
and
or
the rich.
poor, or yeah.
So it's just about which are the options that we take as individuals. And we love ourselves by protecting ourselves, and by doing that, we protect the ones that we love. Yeah. So, but if we take things loosely, then we're stuck. And those good records that we started mentioning at the beginning can reverse as well. As you've been talking about India, they were doing really well, and look at the situation now. So let's avoid that here by getting tested, getting vaccinated, taking advantage of all these many opportunities. One more to add in the list is for those that are confined at home for physical reasons. Those persons that are disabled, they can have access to the vaccine without the problem of getting into the clinics or the pharmacies or whatever. For persons that are disabled, they can request the vaccine to be taken to their home. Imagine that.
Wow.
It can get better than that. All they have to do is call 707-565-4667. That's again 707-565-4667. If you are disabled, you want the vaccine, that can be done at your own house. So don't hesitate, just get vaccinated.
Definitely. And again, just a reminder to our community, other people are suffering, and yet we have the opportunity, we have it here. They're saying that in New Delhi, there's somebody dying every 4 minutes in that country, every 4 minutes. And it's just in one city. And again, you have, so many individuals. And so we have the vaccine, take the vaccine. And as you said, it's a way of being respectful for those around you. And then let's get back to some form of normality, and let's move forward. Let's open the economy fully, and let's get back to school. Let's get back to work. Otherwise, the economy is going to continue to suffer, which means we continue to suffer. And with that, I want to thank you as always for coming over, taking the time and bringing us the latest information. And I look forward to having another conversation in a week, hopefully with even better news in regards to the number of people who are vaccinated, and the fact that, again, we are hopefully moving to the next tier, which is the yellow tier. Thank you.
That would be great to come next week and tell you that we're in the yellow levels, or at least in a couple of weeks. Thank you for having me, and I look forward to visiting you next week.
Thank you. Take care.
Take care. Bye.